For many people, going to the doctor can be uncomfortable strictly because, for some, it can be embarrassing to talk about a medical issue or to have certain examinations. One local practice wants to help women feel more at ease. Here to tell us more is Dr. Stephanie Molden of the Female Pelvic Health Center in Newtown, Bucks County, Pennsylvania. Dr. Molden, great to talk to you about this subject, which in some cases can be very sensitive for women. But the thing that's so interesting, there's not many pelvic health centers for women.
That's correct. This is a fairly young subspecialty of gynecology. So there are few doctors such as myself that treat these conditions more and more each year as more physicians are getting trained. However, it is a unique subspecialty that treats only women with urogynecologic issues and pelvic floor disorders. Things such as incontinence, prolapse, pelvic organ prolapse, fecal incontinence, painful bladder issues, things that are a little bit unusual and not often talked about.
Well, it's interesting. They're not talked about. Women feel embarrassed by it, but yet it really affects their life.
Absolutely.
Yeah, I mean, tell me the situation when women come to you and they have been dealing with this for such a long time and they see maybe a ray of hope.
Yes, I see lots of women who've been dealing with this for many years and feel that they often just have to live with these disorders or just aren't aware of the opportunities and treatments that are available to them, or that such subspecialists as myself even exist. So absolutely, our goal is to restore the quality of life for those women and often cure or at least significantly improve their conditions.
Now, so if you have urinary incontinence or incontinence of any kind, does it mean that you must have surgery?
No, absolutely not. There are many options, and we really try to tailor the treatment to the patient. Everyone has different desires, different healthcare status currently that may dictate certain options. However, there are many conservative treatments. There are therapy programs that we offer, such as physical therapy for the pelvis in our office, and then there's often surgery. And the good news about surgery nowadays is with the minimally invasive techniques, which we almost 100% employ, the surgeries are much more easily tolerated and the patients recover much more quickly.
Why do some of these conditions even arise?
That's a good question. So just being female is a major risk factor. Women who've undergone childbirth certainly are at increased risk. Postmenopausal women, aging processes of our bodies change, the support in our bodies, especially around the bladder and the pelvic organs. So there are lots of risk factors, even genetic factors. This tends to also be in families. I see a lot of women who discuss this problem from their mothers and having had surgeries in the past as well. So there are lots of risk factors, but 1 in 3 women suffer these disorders.
So but yet,
at some point.
With this new subspecialty, with this, essentially young subspecialty, there's hope.
Absolutely. There's always hope, and there's something we can do for almost everyone.
All right, Dr. Stephanie Molden, thank you.
Thanks
very much. For more on the Female Pelvic Health Center, you can go to cbsphilly.com and click on to Talk Philly. We're coming right back.